Hi, ladies. Good morning. How is everybody doing today? Good morning to everybody. So, I want to say thank you to all the ladies and gentlemen that are tuning in to our platform, We Only Fun from the city of Bronzeville. I greatly appreciate every one of you ladies. Okay, so, amigas, today we're going to be speaking about what are the legal requirements to open any healthcare agency, okay, in the state of Texas. So, it's not an easy thing, amigas. I believe it's a very long process, okay? So, I decided to bring this topic to everybody so that we can all get educated and, take more seriously how we can open this kind of business. Okay, everybody's able to open this type of businesses, but there is a lot of requirements that the state of Texas requires for the owner um, to have before they can provide services to any citizen, any client, any patient. Okay, however you want to say it, there is a process. It's not easy, but it's not impossible either. Okay, so if you're looking to open a business, a healthcare business, I highly encourage you to look at all these steps that we're going to be talking about at this moment.
Starting a home health agency in Texas is a highly regulated process. The Texas Health and Human Services Commission, HHSC, oversees all licensing, and your agency will fall under a specific designation depending on the type of care you want to provide. The essential legal permits, licenses, and steps required to legally operate a home health agency in Texas include the following. 1. The Core State License, HCSSA license. To operate legally, you must obtain a Home and Community Support Services Agency, HCSSA, license from the Texas Health and Human Services Commission, HHSC. When you apply, you must choose one or more license categories based on your business model. Licensed Home Health, LHH, allows you to provide professional medical-related services like skilled nursing or physical therapy to patients in their homes. Personal Assistance Services, PAS, specifically for non-medical home care, such as assistance with eating, dressing, bathing, and light housekeeping. Note, if you only want to do non-medical companion care, this is the specific category you need. Hospice, required if you plan to offer end-of-life care. The cost. The initial application fee for an HCSSA license is $2,625, and the license is valid for a 3-year term. 2. Mandatory pre-licensure training. Texas requires your chosen agency administrator and alternate administrator to complete state-approved training before you can submit your license application. Initial training. Administrators must complete an approved 8-hour initial education course regarding HCSSA regulations before applying. Follow-up training. Once open, administrators must complete an additional 16 hours of training within the first 12 months, followed by 12 clock hours of continuing education every year after. 3. Federal permits and certifications, if applicable. If you intend to bill the government for your medical services, state licensing is not enough. You must also obtain federal certification. Medicare/Medicaid certification. If providing skilled medical care and you wish to accept Medicare or Medicaid payments, you must apply for certification through the Centers for Medicare and Medicaid Services, CMS. This involves filling out a CMS 855A enrollment application and proving compliance with strict federal conditions of participation, COPS. National Provider Identifier, NPI, a unique 10-digit identification number issued by the National Plan and Provider Enumeration System, NPPES, used for healthcare billing. 4. Business infrastructure and local registrations. Before applying for your health license, you have to establish your legal entity in Texas. Secretary of State, SOS, registration. You must register your business structure, such as an LLC or corporation, with the Texas Secretary of State. The filing fee is typically $300 for an LLC. Employer Identification Number, EIN, obtained for free from the IRS for tax and payroll purposes. Texas Comptroller of Public Accounts. Your business must register and maintain a status of good standing for state franchise taxes. 5. screenings, and staff credentialing. Because your staff will be entering patients' homes, Texas law mandates severe background protocols. Fingerprint-based background checks. All owners, administrators, and key personnel must undergo criminal history checks through the FBI DPS database. Employability status checks. Before hiring any staff member, you must check their status on the Nurse Aid Registry, NAR, and the Employee Misconduct Registry, EMR, to ensure they are legally employable in a long-term care setting. Professional licensing. Any specialized staff you hire, RNs, LVNs, physical therapists, must hold active, valid professional licenses with their respective Texas state boards. 6. Policy manuals and inspections. Operational policies and procedures. You must draft comprehensive manuals detailing how your agency handles patient care, emergency preparedness, data privacy, HIPAA compliance, quality assurance, and employee conduct. Initial HHSC survey. After your initial license is issued and you admit your very first client, you must submit a written request for an on-site initial survey inspection by the HHSC within 6 months to prove you are actively following all state standards. Tip: applications, document uploads, and fee payments are all managed digitally through the state's portal, the Texas Unified Licensure Information Portal, TULIP.
So, hey, Lenny. Hi, how are you, Lenny? Thank you so much for being here. And the reason why, amigas, I'm bringing this topic, to the table to everybody is so that we can all learn and be aware of the legal steps that anybody needs to take before having a business of healthcare as a healthcare agency. Okay, so it's a lot of steps, amigas, and it takes time, it takes money, and as we all heard, it's not an easy thing to do, but not an impossible thing to do. I highly encourage, whoever has the thoughts of opening a business, a healthcare business, this is what you're going to have to go through, okay? In order for you to be able to operate the legal manner and the right way in the state of Texas, okay? So this is what it takes to open a healthcare agency to provide services to the community, okay? I thought I would, talk about this because a lot of us have a lot of dreams, amigas, and we want to be able to succeed in life. And sometimes we don't have that, the knowledge or the understanding, or we don't know what the process is and stuff like that, So, um, and sometimes there is people that want to open a business, but they miss a lot of steps, legal steps. So this is, to help anybody. This information is to help anybody that wants to open a business, to make their dreams come true. It's not impossible, amigas. There's tons of agencies here in the state of Texas that also went through the same process, the same steps, that I'm mentioning, and maybe there is even more steps to take, okay? And the reason why I'm saying this is because the state of Texas is very, very peculiar in these type of businesses, okay? They want to be sure that the person is qualified, the owner, the agency is going to be qualified to be providing this type of services, and that our community, our clients or customers or patients are going to be getting exactly what they are looking for. Okay, a good treatment, not only a good treatment, but the healthcare and everything that comes with it. Okay, so I highly encourage everybody, like, if you're looking for a healthcare place, make sure that you look into the following. And allow me a second. Hold on. Okay, so right now, okay, we're gonna go into, if I want to get the services of a healthcare company, what licensing I need to look for or ask for, and what would be the red flags to see. Okay, so
When you are hiring or contracting with a healthcare company, like a home health agency, personal care service, or hospice care provider, to come into your home, you are trusting them with your or your loved one's physical safety, personal privacy, and finances. To protect yourself, you should look for specific credentials and actively watch out for critical warning signs. 1. What licensing to ask for and verify? In Texas, you should explicitly ask the provider for their licensing information and then verify it yourself. Do not just take their word for it. The state license, HCSSA. Any legitimate company providing care in a person's home in Texas must hold a Home and Community Support Services Agency, HCSSA, license issued by the Texas Health and Human Services Commission, HHSC. Ask them what category of HCSSA license they hold. Licensed Home Health, LHH. Look for this if you need medical care, injections, wound care, or physical therapy. Personal Assistance Services, PAS. Look for this if you only need non-medical care, such as cooking, companionship, bathing and cleaning, Medicare/Medicaid certification, if applicable. If you plan to have Medicare, Medicaid, or a managed care organization, MCO, pay for the services, the agency must be Medicare certified and have a valid National Provider Identifier, NPI number. If you are paying entirely out of pocket, this certification is not legally required, but it does show the agency meets strict federal standards. How to verify it instantly for free. Do not rely solely on a piece of paper they show you. Go to the official state portal, Texas TULIP Long-Term Care Provider Search. You can type in the agency's name or license number to see if their license is active, expired, or facing state disciplinary actions. 2. Crucial questions to ask the agency. When interviewing a healthcare company, ask these operational questions to ensure they are protecting their clients. Are your caregivers direct W-2 employees of your company, or are they independent contractors, 1099? W-2 employees are typically better trained, supervised, and covered by the company's insurance. Do you perform FBI fingerprint-based criminal background checks on every employee before sending them to a home? Are your caregivers bonded and insured through your agency? This protects you if a caregiver steals something or causes accidental damage to your home. 3. Major red flags to watch out for. If you notice any of the following warning signs during your initial consultation or early interactions, it is best to look for a different provider. The no license red flags. They claim they don't need a license. If an agency tells you, we just do companion care so we don't need a state license, walk away. In Texas, even non-medical personal assistance agencies must be licensed by the HHSC. Only individual, independent private caregivers hired directly by a family are exempt. They cannot provide a license number. A legitimate agency will give you their HCSSA license number immediately upon request. Operational red flags. Demanding large upfront cash payments, legitimate agencies use standard billing, invoice structures, or work directly with insurance/Medicaid. High-pressure demands for upfront cash or wire transfers are massive red flags for scams. Vague hiring practices. If the coordinator cannot explicitly confirm that their staff undergoes background checks, drug screenings, and state registry verification, checking the nurse aid and employee misconduct registries, they are cutting dangerous corners. No written plan of care. A licensed agency is legally required to conduct an initial assessment and create a structured plan of care signed by a supervisor or physician detailing exactly what services will be provided. If they try to start care without a written agreement, it is a violation of Texas regulations. Poor or defensive communication. If they become defensive when you ask about their licensing, insurance, or supervisor oversight, or if they lack a clear 24/7 protocol for emergencies or caregiver callouts, they lack the infrastructure to keep a patient safe.
So that is another thing that everybody needs to take into consideration, amigas. And sometimes people don't understand. Like this gentleman was just explaining right now. If a family hires a friend, they don't need to have all this stuff. Okay, so but if they're working through an agency, they do need to have all the protocols and all the documentation that the state of Texas requires for them to have. Okay, so I just wanted to give you guys a little tip of what is needed. Okay, in order to open a healthcare um, facility. It's not easy, amigas. It's very hard, and unfortunately, the government has like really implemented all this steps, legal steps, that if you want to open a business, you need to have all this licenses, all this background checks, and everything has to go by the book. Okay, why? Because you're going to be dealing with people's lives. Okay, and it is very, very important to to have everything as required to have. Okay. Now, um, it clearly spoke about also, or it stated right now, the red flags, what to look for when you go to an agency and you want to hire their services. Okay, to take care of your mother, your father, your child, whatever the case is. Okay, or even for yourself. So it has already been explained what you need to look for, what you need to ask, and what you need to see. If the company fails to provide you with all the information that we have just spoken about, those are red flags that you need to look out for, and you need to step away. Okay, because that company's is not complying, or probably is not complying strictly with the state of Texas um, regulations. But again, I just wanted to make it clear, if you want to hire a friend to take care of your mom or your neighbor or whatever the case is, you are very, very welcome to do that. And none of this um, expectations, or licenses are needed. Why? Because it was your choice to hire this individual person to provide you with the services. And to be honest with you guys, I think it's a better option, to for anybody to find a good person, or a person well, that's going to be at your own risk as well. Okay, but it's a better option, amigas, because it's cheaper. Okay, sometimes from what I heard, the patients or family members talk about is that they, even though that they hire the services of an agency, they have insurance. The insurance only covers so much, and they have to pay out of pocket. Okay, so when that happens, amigas, you know, the bills are very high. I'll tell you that much. Very, very high. Like, so let's just say if the client gets a check, and it only qualifies for certain, and it has insurance, and it only qualifies for certain services. Okay, so the agency will provide those certain services, but the client will have to pay out of pocket for the rest of the bill. Okay, so what does that mean? That if the client gets their check from their government check, they have to cover those expenses. Or the other one is that I've heard is that sometimes and this is one that I really don't understand why they do that, but something about their properties. Okay, so when when they're not able to cover all the expenses, I don't know how that works, or I really not too much informed, but they're using the patient's property And when the patient passes away, the agency or the government, I don't know which one it is, they take their property and cover all the expenses. Okay, um, so basically, to be honest with everybody, I think it's a much better way. It's a more risky situation, but if we're talking about in a sense of money wise, I think it's much better to hire somebody to do a private pay, and just letting them know what your expectations are. Okay, so it's much cheaper, and and it's understandable why people take that route, and they don't want to go through the government um, route situation, and I just explained it why. Okay, so if that's what you're doing, a private if you're doing private services, okay, so a lot of stuff is not expected from you in the sense of certifications and any of that stuff. Okay, so it's okay to do it, but when you're trying to open a business and you're operating as a home health or healthcare agency, there is a lot of steps that you need to take. There is a lot of licenses that you need to hold, and there is a lot of trainings, educational, things that you need to go through in order to be complying with the state of Texas to have a healthcare business. And this is to avoid a lot of things, amigas. The state of Texas actually really wants for you to, or for the person that is opening the business, that they are aware of what they're getting into. They need to have all the proper training for everything, the proper knowledge for everything, so that you will be aware and won't make those mistakes. Okay. And basically, it's also for the person to be transparent, and that you do have uh, a legal healthcare agency, and you're being transparent. Why? Because you have all your stuff, okay, all your licenses, permits, background checks, and all that stuff. And this is very important because there is people that do get hired in agencies, which some of them, not all of them, they fail to conduct background checks. Okay, so then what happens in a lot of situations do happen in the home of that client, and that's what people or the state of Texas is trying to avoid. So this is why it is very important, amigas, to have everything by the book, to go by the book, exactly what they're telling you to have, and so that you can be in compliance. Okay, and there will not be any type of excuses. Oh, well, I didn't know, or this or that, none of that. So and now let me go to the last one. Okay, hold on. There's another one. Okay, so now we're going to be discussing about the medications. Okay. um What is legally required in the state of Texas to be a medication aid for a client or a patient? And can anyone practice this method without a license? Okay, so this is very important, amigas, because it's going to bring a lot of comprehension into this topic. Okay. Giving out medications is a very and this is what sometimes they do at the home agencies. Okay, but giving out medications is a very serious topic. Okay, I, as everybody knows, I've been in the medical field for years, and not anybody is able to be giving out medications. Okay, so only the people that hold the license in the state of Texas are able to give out medications. And we're talking about if we are working with a company. Okay, so definitely you do have to have a license. But when you're working private as a private pay, it's a different story. And let's listen to it.
In Texas, the administration of medication to patients or clients is strictly regulated to ensure patient safety. Here is how the law breaks down regarding medication aid permits, requirements, and whether anyone can practice without a license. Can anyone practice this method without a license? No. In a professional healthcare setting, it is illegal to practice as a medication aid or administer medications without a valid state license or permit. Under the Texas Administrative Code, Title 26, Section 557.103, a person cannot legally administer medication to a resident or patient unless they 1. Hold a current professional license under state law authorizing them to do so, such as an RN or LVN. 2. Hold a current medication aid permit issued by the Texas Health and Human Services Commission, HHSC, and are operating under the direct supervision of a licensed nurse, the private/family exception. The only major exception to this law is informal, uncompensated home care. A family member or designated unpaid private caregiver can administer medications to a relative or friend at home without a license. However, the moment a person is hired or employed by a facility, agency, or institution to provide medical care and administer drugs, formal certification or licensing is strictly required.
Okay, so that is very important for everybody to understand, amigas. Okay, so if you are hired, okay, by a company, you must hold your license. But if you're hired as a private caregiver, private pay, you don't need this license.
Legal requirements to become a medication aid in Texas. To legally work as a certified medication aid, CMA, in a Texas nursing home, assisted living facility, correctional facility, or home health agency, you must obtain a permit through the Texas Unified Licensure Information Portal, TULIP. The state mandates several strict prerequisites before you can even take the training course, followed by strict licensing steps. 1. Prerequisite experience. You cannot enter a medication aid program completely green. Texas requires prior direct care experience. You must hold a current certified nurse aide CNA designation, or be employed as a non-licensed direct care staff person. You must have been employed in a state-approved facility or home health agency for at least 90 days during the 12-month period before the first day of your medication aid training class. 2. General qualifications. Be at least 18 years old. Hold a high school diploma or a GED. Be able to read, write, speak, and understand English. Be in suitable physical and emotional health and free from communicable diseases. 3. Education and training, 140 hours. You must successfully complete a state-approved medication aid training program, which typically totals around 140 hours. This program consists of classroom instruction covering medical abbreviations, body systems, common diseases, drug reactions, and safe preparation/administration methods, oral, topical, inhalation, etc. Hands-on clinical practice and return skills lab demonstrations under the direct supervision of a licensed nurse. 4. Background checks and registrations. FBI fingerprint background check. You must submit fingerprints through the Texas Department of Public Safety, DPS vendor, IdentoGO, to verify you do not have a disqualifying criminal history. Registry verification. You cannot be listed as unemployable on the Texas Employee Misconduct Registry, EMR, or have a revoked/suspended status on the Nurse Aid Registry, NAR. 5. Passing the state exam. After graduating from the training course, you must apply to take and pass the official Texas HHSC Medication Aid Examination, which consists of 100 multiple-choice questions assessing accurate and safe drug therapy. Supervision rules after licensed. Once you successfully secure your Texas medication aid permit, you cannot practice independently. By law, a medication aid must function under the direct supervision of a licensed professional nurse, an RN or LVN, who is actively on duty or on call by the agency or facility employing you.
So there it is, amigas. So now that we all have a clear understanding of who is able and who is not able to give medications. Well, I decided to bring, this information to the table so that we can all be on the same page and be able to understand what you're able to do and what you cannot, what you cannot do. And I hope this information was, very useful to everybody. Um, and use it. Absolutely, ladies and gentlemen. If you are one of those persons that you are a private hire, or you work for an agency, these are the things, the real stuff, okay, that you need to be aware of, things that you are able to do and things that you're not able to do. Okay, if you're a private hire, you're not through an agency, you're not through the government, okay? That's a different story. Most of it does not apply to you, okay? So, the rest, if you're hired by a company, by an agency, then obviously it does apply to you and to the company. Okay, so allow me another second. Okay, so right now, the next that we're going to go into, what happens if a private caregiver gives the wrong medication to a patient or client in private hire? What could be the consequences? Okay, so this is very important, amigas, okay, because it does happen. So this is the reason why the state of Texas and everybody requires for people to have the knowledge and how to handle medications. Okay. It's not an easy thing. Sometimes people think, oh, it's just a medication. No, there is things that you need to be aware in regards to medications.
When an individual is hired directly and privately, a private hire setup separate from a licensed agency, the legal relationship changes dramatically. Because there is no agency corporate buffer to absorb the liability, the consequences of a severe medication error fall squarely on the individual caregiver and, in some cases, the family who hired them. The consequences depend on three factors: the extent of the harm caused, whether the error was an accident or intentional, and what specific certifications the caregiver holds. The potential legal, financial, and professional consequences include the following. 1. Criminal charges, the state versus the caregiver. If the wrong medication results in a patient being hospitalized, poisoned, or dying, local law enforcement and Texas district attorneys will investigate. A private caregiver can be charged criminally even if it was, quote, just an accident.
So this is the reason why it is very important. If you are not licensed to be a medication aid in a patient's life or a client's life, do not give medications, okay? And this is so everybody can be aware of what the consequences could be, okay? You will not be exempt from it. So this is why handling medications is very delicate and, very serious.
Injury to an elderly or disabled individual. Under Texas Penal Code Section 22.04, it is a felony to intentionally, knowingly, recklessly, or with criminal negligence cause bodily injury or serious mental injury to an elderly person, 65 or older, or a disabled person. If the medication error causes serious bodily injury, it can be prosecuted as a first or second degree felony, carrying sentences from 2 to 99 years in prison. Criminally negligent homicide or manslaughter. If the medication mix-up results in the patient's death, the caregiver can be arrested and charged with manslaughter or criminally negligent homicide. 2. Civil lawsuits. The family versus the caregiver. The patient or their surviving family members have the right to file a personal injury or wrongful death lawsuit against the caregiver in a Texas civil court. Financial judgments, damages. The caregiver can be sued for economic damages, the cost of the emergency room visit, extended hospital stays or funeral expenses, and non-economic damages, pain, suffering, and emotional trauma. The private hire trap. Unlike employees of a large health agency, private hire caregivers rarely carry independent professional liability insurance. A civil judgment can result in the court ordering the caregiver's personal assets seized or wages garnished to pay off the debt. 3. Loss of professional credentials and state blacklisting. Even if a caregiver avoids jail time, a medication error will likely end their career in caregiving. The Employee Misconduct Registry, EMR, Texas, maintains a database of individuals who have committed abuse, neglect, or exploitation against patients. A severe negligent medication error is legally considered physical neglect. If placed on the EMR, that individual is permanently blacklisted and banned from ever working in a Texas licensed facility or agency again. Loss of license. If the private hire possesses a CNA license, a medication aid permit, or a nursing license, LVNRN, a formal complaint will be filed with the Texas Board of Nursing or the HHSC. Their license will likely be suspended or permanently revoked. 4. Unexpected liability for the family hiring them. In a private hire arrangement, the family itself faces unique legal risks if a mistake occurs. The employer status. If the family pays the caregiver directly under the table or treats them as an employee without clear paperwork, Texas law may view the family as the legal employer. If the caregiver makes an error, the family could technically be sued for failing to adequately screen, train, or supervise their employee. Insurance denial. Most standard homeowners insurance policies will explicitly deny coverage for medical mistakes made by an unbonded, privately hired worker, leaving both the caregiver and the family financially exposed. Immediate action required after an error. Under Texas guidelines, if a medication error occurs, the very first step is always medical intervention, calling 911 or poison control immediately. Fleeing the scene or trying to hide the mistake to avoid the consequences outlined above elevates a simple error into a deliberate act of abandonment and severe criminal neglect.
So there it is, amigas. There it is. Es un arma de dos filos in both ways, if you hire or if you don't hire, okay, a person with a license. Okay, so that being in the healthcare field is not an easy thing, amigas, and of course you hold a lot of responsibilities, okay, especially dealing with somebody else's health. So this is why it is very important, if you're going to be doing a private hire, private pay, not involving any agency, at least just make sure that you do train or have an expert to train the person how to give out the medications, the timings, and everything, okay? Because it is very, very important to be aware of, and to handle this whole situation the proper manner, okay? It's a very risky way, but, it is what it is. So everybody already knows the consequences if there is a mistake. If the client suffers in any way, form, or shape because of the mistake or the error of the medication, got them mixed up, you gave more, you gave less, it all falls, all into one place. Okay, so you already know what to do. Don't try to hide the mistake. Why? Because it can definitely bring some consequences to the client, and you're going to be in serious trouble. So the best, if there was a mistake done, automatically report it to your direct supervisor. In this case, since it's a private pay, to the person that hired you, and then you guys work it out together. And not only to the person that hired you, but also call 911 and the poison facility as well. Okay, so never hide those mistakes or those errors, amigas. Always be transparent about the situation. And but that's what I wanted to say. That is the risk that any family takes when they do private hires that that don't belong in an agency or not working for an agency. Okay, because if they were working for an agency, believe me, all their people, 99% of their people are trained, they have licenses, and they are working within the state of Texas regulations. Okay, so this is why um, a lot of people do prefer to hire through an agency because they already know what to do than to hire a private pay. But like I explained earlier, there is people that rather hire somebody private pay because not taking into consideration, that they don't have the proper knowledge to give out medications, how to treat a client or a patient with certain disabilities or special needs and stuff like that. They're doing it because it's cheaper, but yet, and yes, there is consequences because you're hiring somebody that doesn't know anything about, what to do in case of a situation. Okay, so yeah, tiene sus pros y tiene sus contras. Okay, amigas. So, anyways, well, this is it for right now, amiguitas. I hope that you guys enjoyed this information. It's very educational, very helpful to the ones that are looking for um, caregivers and stuff like that. You already know what to look for when you go to an agency, the licenses that you need to see or that you need to ask for. And if you're not too sure, go ahead and rewind this video again and listen to it, properly so that you can understand everything about when you're going to hire a caregiver from an agency. The other topic was if you're trying to open a healthcare agency, and the other topic was the last topic was giving out medications and the consequences when you're not licensed. And you have it all, amigas. I hope this is helpful to everybody. Remember always to try to do things the right way. It's going to save you a lot of heartaches. It's going to save you a lot of trouble. And we definitely, when we are looking for somebody to take care of our loved one, we want to make sure that that person is going to be taking care of them the way that we would take care of them. Okay. And so this is why it is important to always look out for all these licenses and and information. So, anyways, amigas, this is it for today. I hope everybody enjoyed it. I love you guys. I've been away for quite a bit, but I've been busy. I've been doing live videos on the other platform, Platicando con Glow, and I've been over there. Okay, so well, not really too much, only just here and there. But I decided today to bring this material to you guys so that we all can learn and we can have the knowledge of what we need to open a facility, a caregiving facility. And it's okay, amigas. Everybody has to start somewhere when they want to open a business. Okay. So, but there is people that will not tell you what are the steps that you need to have and need to take in order for you to be operating the right manner, the legal manner. And I just decided to bring this little help to you guys so that you can have at least some type of knowledge and you can do your little research and then you can take it from there. It's not impossible. Okay. So all the people that do have businesses is because they did their little research. They followed through every step and they got their licenses and everything, amigas. Okay, so you're able to do it too. If you're looking into doing that, go ahead and try it out. Don't give up. Yes, it sounds like it's a lot, but at the end of the day, it's going to be worth it. Okay, because you will be putting into action your dreams. Okay, so never give up on your dreams. If that's what you have, never give up on them. And nothing is easy in this life. Everything is, a little complicated and, sometimes stressful, but not impossible. You're able to do it. Okay, so good luck to everybody, amigas, and I hope that you guys enjoyed this video, and see you next time. Thank you so much for being here. Okay, bye.